at Lillian's radio show. There we go. It says that we are streaming. Here we go. It says we are streaming live. So I am going to get my my YouTube and my Facebook, and I ask all of you to do the same. Please go out and start sharing and liking and telling all your friends that we have Lisa Geyer of Live Longer Medical. So let me start my record while you guys are texting everybody and telling everybody to watch and learn, because today we're going to talk to Lisa Geyer of Live Longer Medical about testimonials, because I'm not the only one that loves Live Longer Medical. Apparently Troy Bell and Tyler Dickman also love Live Longer Medical. So today we're going to talk about hormones, but not just from Lisa, but from people who have experienced pelleting. So fasten your seatbelt, because we're going to learn and grow together. Here you go. It's time to dance.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friends. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are tuning in to the classroom for the first time, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my commitment to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friends, will feel empowered to embrace a new truth and live the life of your dreams. Now, so many people want to live the life of their dreams. They're doing everything they possibly can, but there's something just missing from the puzzle. What is it? And that's why I love having Live Longer Medical, board certified health coach and CEO of Live Longer Medical, Lisa Geyer, who has helped us understand the body in a different way. As I always say, Live Longer Medical helps us look as beautiful on the inside as we do on the outside. And so today, apparently, I'm not the only one that absolutely loves Live Longer Medical and has experiences as a patient there. We do have more people. We have Tyler and Troy. We're going to bring them later on in the broadcast. But for now, since there's our sole purpose in life to give and receive love and knowledge, I'm grateful that Lisa Geyer is here to do just that. Welcome back, Lisa, to the classroom.
Thank you, Lillian. Oh, it's wonderful to be with you.
Yeah, it's always nice when you come around and share. We've had some great conversations, and I really have enjoyed learning so much from you. But today we're going to talk about Live Longer Medical and some of the good it's doing for the patients that you are seeing. So to share a little bit about what we're going to talk about today and why many of your patients, we just selected two, but would have been here to talk about the services.
So, at Live Longer Medical, I think our goal is to find the biochemistry that's unique to each person and treat accordingly. So when you do that, hormones is a piece of that. I think that's a big part of our discussion today. Mm-hmm. But everyone has their own personalized biochemistry. And one of the things we really try to do is kind of find that unique piece that people might be missing, and there could be different issues that they're experiencing, whether it's fatigue or lack of motivation during COVID. And while we're still somewhat in it, we see a lot of patients with other issues too, like depression and anxiety, and all of these things play a role in how we function every day, and also how it affects our longevity. And I think that's an important piece, because everything that we do today can enhance or harm, how we live out our life, and how we perform every day. Cognition is extremely important, and that's something that we also address at Live Longer.
Very good. So we're going to bring in Tyler Dickman, and Tyler has limited time. So we're going to bring him in as quickly as we possibly can. And Robert, I know that you're working on, getting things situated there. And so I want to welcome you, Tyler, into the classroom, and you're going to be our teacher today.
Oh, Jesus. Hi, how are you doing?
I'm fine. How are you? I'm so glad. So you are a patient. How long have you been a patient of Live Longer Medical, and why did you choose Live Longer Medical?
So I've been a patient for a little over a year now, I believe. I'm from down south, from Jupiter, by West Palm Beach, and I moved here a little over a year ago. And this is, I just did some research online about the closest doctor that had experience, or office that had experience in hormone replacement therapy, and Live Longer Medical popped up. And I heard some good reviews, so I went ahead and give it a shot.
So how old are you, if you don't mind me asking, Tyler?
I'm 30.
You're 30 years old. You're very young.
Yeah.
So no one would ever think a 30-year-old would be seeking pelleting. Why did you seek that for yourself? Were you feeling a certain way? I know you moved here and you were looking for that, but why?
Okay, so originally, when I was, diagnosed with low testosterone, I suppose you want to call it.
Okay.
It was, I kind of always assumed. I don't know how to. It's hard to say when you don't know what you feel like, or when as I feel now. So now that it's easy for me to identify now that I feel amazing and I feel great and I feel all this energy and clear-headed, focused, motivated, and it's easy to reflect back and be like, okay, that was missing. That's what was missing. I can tell that fixing that, fix that. But I think it was really just I saw people, they had a much easier time than I did, I guess, in the gym and stuff like that. And there's just so many benefits to having optimal levels of testosterone. It affects your whole body, and it was pretty evident at one point. And I just want to get my levels checked, and here I am.
And so, okay, so are you using this because it helps your performance in the gym, or was this affecting your entire life?
It's affecting my entire life, absolutely. I just quality of life, I think, is the most important part of life. If you're not healthy, you're not going to enjoy life. And I'm not gonna lie. First time I ever went to a gym wasn't to be healthy; it was to look good. But the more I did the research, because I'm the type of person where if I start something, I'm researching it to the end, and I want to know every professional opinion before I start it, because I'm just paranoid, I guess. And once I finally took that dive, and I've been happy ever since. But it's a full package. It's definitely more than just the gym.
I love the fact that you're coming forward and talking about this. You're a young man, and there is this stigma about, the gym, and you're like, oh, manly man, lots of testosterone. Was it embarrassing for you? Did you have any apprehension to acknowledge this yourself, or acknowledge this to your friends? How did you come to that decision where you're saying, I need to not only do this when I'm, in, Jupiter, but when I come to Melbourne, I also want to do this for myself too?
Right. So it wasn't, I don't know how to describe it. It wasn't as bad as it could have been, I suppose, because it is a little bit embarrassing, I suppose, if you want to call it that. It's personal. It's nothing.
Yes, personal.
Really.
Let's say personal, and maybe not embarrassing. I apologize for putting a label.
No. I can definitely see. Look, I don't I try not to view it that way, but it's very easily, and I can understand why it's embarrassing because nobody wants to talk about how they're not man enough or something because we view testosterone and the word and using it as synonymous with being a man and your manlyhood or whatever. It's just the way it is. But I felt the more you understood it, the more it's not really the way it works. And I didn't have too much of a problem after I just owned it, I guess. I don't know how to describe it, but
Well, no, you took a stand for yourself. And I think that many men, need to do that for themselves because, you're taking your health back and not necessarily feeling the pressure of looking a certain way, but you also want to feel a certain way. Lisa, is there anything that you want to say about Tyler or anything that you would like to ask him?
I think it's assumed in our culture that once you're in your 40s or your 50s or your 60s that you are going to have an issue with testosterone for men. I mean, women can have an issue too, but it's something we somewhat assume in our culture. But I've seen over the years many young men in their 20s, including one of my sons, who really had an issue in his 20s with very low testosterone, and it was affecting his self-esteem. It affected his motivation, just his ability to be just motivated. And we saw a huge difference just addressing that. It's unfortunately something that a lot of physicians wouldn't even look at. If someone came in and they were young in their 20s and they looked strong, like Tyler looks very strong and he's, a very good looking young man, they wouldn't think of testosterone. It might not even be addressed. And we've actually had some young people that come in and they've been to several doctors and no one takes a minute to look at their hormones because they think, oh, it's a young man in their 20s and they don't have an issue. But typically for men in their 40s, they do start to see a decline. And that does affect our longevity and how we feel every day and how we function. So I think it's a shame it's something that's not been addressed in younger men. And for my son, thankfully, we did address it, but it's much more common than we think.
Yeah.
And the reasons why people aren't methylating or maintaining their hormone levels varies from person to person. And it could be a myriad of reasons. It could just be genetics. Mm-hmm. It could be some heavy metal exposure they've had that's really kind of draining their body's ability to metabolize and use the nutrients that they take in every day, including hormones. So, it can be a lot of different things. It could be diet. Even diet has a huge effect on hormones.
Yeah.
So, I think it's awesome that Tyler was able to address that in his life. And, that will help him with his longevity. And as he ages, he'll age better than most, and it will really make a difference in his life. And when it comes to testosterone too, and I noticed this with Tyler, he was very conscious of managing it with integrity and science and doing it properly. And we do see some people that come in and they want to take excessive amounts, and it can really be destructive, and it can cause a lot of side effects that would actually limit longevity. But sometimes, guys don't see that. But Tyler was well educated. He took the time to understand that. And again, with pellets, they are customized to you, the patient. So based on your levels, those pellets are customized to your body and how your body is using the hormones. And so that's a huge piece that I think the pellets serve for most people.
Yeah. And these are bioidentical hormones. These are not, like shooting up testosterone or anything to that effect.
No.
Tyler, I want to follow up on something Lisa said, and maybe you can address this. When you went to the doctor for the first time, before you knew you had low testosterone, did they try to pump you up with different drugs like, antidepressant or whatever? Did they try to say, oh, just, you're just not motivated? Or
so I have literally taken every antidepressant there is known to man before.
Oh boy.
Before this, I'm not sure, how positive the correlation is. We obviously know there is a correlation, and it's huge, whether it's secondary or primary reason for the depression. But it was definitely, like Lisa said, it's definitely not really looked at as a possible, cause for these things when you're this young. It's kind of like a, I don't know, like a dogma or stigmatism,
Yeah.
or
Yeah, stigma
yeah,
is
it just
yeah.
right. So which is unfortunate because everybody, no matter how old you are, is going to have there's optimal levels for and there's Lisa said, like some people want to take more, and it's actually destructive and it's negative, the impact, and which is obviously not what we're trying to do. So when you have somebody who can tailor your needs to you and is that in depth, like Live Longer Medical, it's just absolutely phenomenal, and it's indispensable, in my opinion, to your day-to-day life.
Very good. I know that you have an engagement. Is there anything that you want to share before you go, with people that are maybe struggling with feeling motivated, or maybe are tired, lethargic, whatever it is? What would you say to, even if they're younger than 30 years old, what would you say to them to help them say, hey, do the research for yourself and do whatever it takes to live your life the way you want to live it?
So I would, the first thing is make sure you just get your levels checked. Just, I know some people, we don't want to know. We just want to pretend like we have all this testosterone in our bodies. We're a man, we're awesome, and we can just play it off like that as long as we're going to test it and see the real numbers. But you're gonna really miss out, and there's I mean, that's putting it lightly. If you don't, if you don't get checked and then see what your levels are, when you could be doing something about it the whole time, and this, if it's not something you like to talk about, no problem. But I guarantee you, the difference that you're gonna feel after getting your levels optimal or where they should be, especially if you're going to a place like Live Longer Medical, you're gonna be like, why didn't I do this sooner? Absolutely.
Wonderful. Wonderful. Thank you so much, Tyler. I know that you have a place to go to, and I really appreciate it. I'm sure Lisa does too. Appreciate your
thank you.
testimony, because it takes a lot of courage to take a stand for your health. So thank you so much.
Oh, no, absolutely. It's my pleasure. Thank you for having me, and I appreciate it.
Yes, yes. And so Live Longer Medical for you guys, because we're going to get the female perspective as well. For those of you guys that would like to learn a little bit more about Live Longer Medical, you can call 321-327-2980. Live Longer Medical is in Melbourne, Florida, or India Atlantic, Florida. It's just a drive away from Vero, or a drive away from Jacksonville, wherever you're listening to today. At least you have a male perspective of what bioidentical hormones can do for your body. So thank you so much, Tyler, for joining us this morning, and be safe with your journey.
My pleasure. Thank you very much. Take care.
You too. You too.
Bye.
Okay, so now we're going to talk some more about hormones and pelleting. And so Lisa, is there anything that you'd like to share about Troy Bell, who came to Live Longer Medical?
Well, I'll let her share, her thoughts about it. But, from a woman's perspective, we have to look at testosterone too. That's also important. But we have those wonderful female hormones that if they're not, synergistically singing a nice symphony, we can be a wreck too. So, and it does make life rock and roll. It does. And one size does not fit all. So when it comes to hormones, you have to be willing to go that extra mile to look at the intricacies of each person. And I always tell all of our patients when they come in for hormone replacement therapy, give it 6 months. And if you're getting pellets, you're going to get them every 3 to 4 months. So you need to give it a couple of rounds for your body to take that in and learn to work with it and just watch your hormones. And we do check them a lot. I think Troy can attest to that. We're pretty careful about making sure that we do a lot of lab testing, because it can change and adjust. But that's just the basics of where to start with hormones and how important it is. And I'll let Troy share her story.
Yeah. Troy, thank you so much for coming to the Lillian McDermott Radio Show classroom, where you get to be the teacher this morning. So let's share a little bit about, what your condition was, and a little bit about yourself, a little bit about your condition prior to pelleting.
Okay, I've been a retail pharmacist for several years, which is very busy. It's 12 to 13 hour days on. When you want to talk about decision fatigue, I can make 200 to 300 decisions in a 12-hour day that can be life dependent. And I was getting a lot of fatigue, a lot of concentration issues and memory, fog, brain fog, that I was able to stay on for my work shifts, but my off shifts, I was not functional very well at all. I even went to get some brain tests done because I thought, oh, something's really wrong with me. And I have a friend in Texas. She's a nurse practitioner. She's been doing the pelleting for several years. She told me, yes, I would do this to my sisters. I would do this to my mom. She does do it for some of her family members that are nearby her. I would do it even to my nieces. It's very safe, that you should just try it. So I found a local practitioner here with Live Longer and decided to give it a try, and it's made a big impact.
How long has it been since you started getting pelleted?
It's been probably been 8 months, actually.
8 months.
I started in January, yes.
Okay. So do you want to share a little bit about your realization about your hormones? Or do you want to share anything about that, and then gradually where you're at today? When was the first day you said, oh, I am so glad I did this?
Yes. Well, I did notice a difference after about a week or two of my first pelleting, as far as having more energy and being more functional on my days off, making my work days a little bit easier. Things like joint pain and, like I said, the memory, brain fog, whatnot, was significantly different. So, but I was nervous doing it the first time. And, but I am very glad I did it. And I went back for a second time and I'll be going back for a third time. So I now see how vital it is. For me, it became an issue where, how long am I going to be able to work because of my function level? And I think that the hormone therapy is giving me more years, definitely giving me more years as being highly functional, versus when we get older, they accept, okay, well, you're going to decrease function, but my job would not allow me to do that. So I'm able to function at a much higher level.
That's wonderful.
Than I was prior to hormone therapy.
What has been your greatest awakening about the importance of pelleting? Because okay, full disclosure, after the show, the class with Lisa Guarino, she's the one who is her nurse practitioner who does the pelleting. After that class, I said, I think I'm going to try this. I think I'm going to do this. So I called Lisa. I said, okay, I'm in. I'm going to try this. And for me, it's been a huge awakening. So with Troy, what was that moment for you? You said, I feel so much better. What was that change in you that you?
I think it was very gradual. And I did do the patches and pills initially prior to doing this, and just talking to my friend that does it in Texas, and her telling me how much of a difference it would make. There's nothing wrong with your brain. You just need hormone therapy. I decided, okay, to give it a shot. And I guess it was very gradual, as far as I didn't notice any real big sudden difference in feeling, but just realizing one day, hey, I'm a lot better. And being able to do a lot more things on my days off. Probably about 3 weeks into it, I noticed I was doing more projects, cleaning out more cabinets, whatever it might be on my days off, that I just wasn't able to be as functional prior to the hormone therapy.
Very good. Very good. Because, those are things we take for granted. We take for granted that our health is going to continue the same. And then the decline starts happening, and many doctors chalk it up to, you're getting older, you're going through this, you're going through that, and they give it a label. Lisa, what makes Live Longer Medical different, and your staff different, to say, okay, yeah, you might have brain fog, and yes, some people may associate that with aging, but that's not what we look at here.
No, I think the goal is to prevent some of the negative side effects of aging. And sometimes, we're losing our hormones sooner than we should, from, like I said earlier, just there could be a lot of reasons why. So, I think being able to take a personalized look at each patient, that's vital, and caring enough about that person, and it takes us longer. I mean, we take more time with our patients. I mean, I was working on patient issues until 8 or 9 o'clock last night. So, we do pour a lot lot more into what we're providing to our patients. And sometimes, it does take more detail. And it also takes someone who's skilled and doesn't, feel stuck in those old paradigms of traditional medicine where you're just looking at one lab level and you're also calling it, well, you're within range, so it's okay. Well, optimal might be on the higher end of that range, or it could be even, uniquely different than those typical ranges. So, I think it requires someone who is focused on learning what is cutting edge and going beyond what is traditional. Of course, the traditional training is vital and important too, but you do have to be someone who cares to look at more of what people need to be optimal, not just marginal.
Yeah. And so with that in mind, I know that I had a lot of questions for Lisa. I'm sure Troy had a lot of questions for Lisa. But if you who are watching either live or later on or listening on podcast, because we love all our podcasters too, we've gotten such an incredible boom of podcasters. It's been so beautiful so even if you have questions, feel free to reach out to me at lily@whenyounneedafriend.com and I'll get your questions to Lisa moving forward. So here's the deal. A lot of people think of this as a procedure, which could consider it a procedure. Were you concerned, Troy, about it? And what was your experience with the pelleting?
So yes, I was concerned at first about any discomfort or pain. And the first one was a little more sore than the second one. The second one was done very expertly with a different person now that's there now. So I was just a little sore, a little swollen, but that did not happen at all with the second one. There was no side effects at all. I couldn't even tell I'd had it done the second time, which was beautiful. So I was very concerned about that. I had to, just keep a waterproof patch on it for 3 or 4 days and not do any exercise or anything for 3 or 4 days so that those pellets could sort of set where they are and not be movable at the time.
Yeah. I tell you what, Tina Guarino is an amazing nurse practitioner. You hit the jackpot, Lisa. Would you like to talk a little bit about Tina and the work she's doing with anti-aging?
So Tina's been in the anti-aging or the integrative world for over 20 years. And we feel very fortunate to have her with us. And she's moving to the area, so she's still flying back and forth. So we have not as many hours with her, as we would like. But just recently, we actually have a nurse practitioner that also joined us. So now I have 3. But the late Jennifer Schneider Weldon used to be with the clinic years ago, and she had been with other clinics over the last few years, and she and I started to talk, and so she's actually working with us too. And she does
Good.
pelleting, and we also do O shots, P shots, wave treatment. These are all things that Tina is doing, and they're cutting edge treatments that are changing people's lives and reducing what they need to do. Is some for the wave treatment anyway, it treats erectile dysfunction. So instead of men using Viagra and Cialis and all these medications that they help, but too much is not always a good idea of using those. So the wave treatment is kind of like lithotripsy, or it's like it's using like an ultrasound that breaks up calcification, and it really makes a difference for men. So anyway, we're trying to bring more cutting edge, useful, non-invasive treatments, and pelleting is one of those as well. And the cool thing about pelleting is that you don't have to worry about did I take my medication today? Did I put my cream on? Oh, did I get too much? And oh, gee, I forgot to wash my hands and I hugged my kids. There's all kinds of things you have to be really careful of with the creams and things like that. And not that they're not useful, but to be able to get the pelleting and it's releasing at a rate that works for you is such a nice easy way to get your hormones up to where they need to be. And then, by checking them every quarter and looking at how your body used what you were getting, and then you titrate it based on what that patient needs. So, bringing these things to patients that are non-invasive, bioidentical, and really make a difference in their life. It really, it's what gets me up in the morning, to be able to really take the time and be a part of so many patient lives. And it's wonderful and it's fun. And it's good to hear these testimonies and see how it's affecting and changing people in their lives and how they function. It's good news.
It is worth the trip. I know people come from all over to go to Live Longer Medical, and I know that you have late nights where you want to make things so much better, a better experience for everybody who goes there. Personally, I'd love to give you my testimonial, but before I do that, I want to thank all my sponsors for making this classroom, because you guys are watching and listening today or in the future because of the generosity of the sponsors. So the first thing I want you to do is please go to whenyouneedafriend.com and subscribe. And the reason I'm asking this is just this week, we were not able to go live. We were not able, and we are being censored. So make sure that you go to whenyouneedafriend.com and subscribe. That way you know what's going on in the classroom, just in case we cannot go live. I'm so grateful that we are live and that you can see us all over the world. But, I want to make sure that you subscribe to BitChute. That way you'll have another source just in case. You just never know. So please subscribe and like and follow, and make sure you share this, because the more you subscribe and the more you follow, the more you like, the more the classroom grows. We need to get this message out there, because I am one, and I've interviewed Lisa so many times and other experts about anti-aging. I don't call it anti-aging. I call it reverse aging, or it being proactive with aging, and not so anti, because I don't like to be anti anything, but I am pro, holding on to your youth. And so I've done this, and even I had some preconceived notions about what this is all about. So this is where we take responsibility. This is where we take ownership for the life that we want to live. We all were created perfect, and something happens along the way. So, and we just need to reclaim our health. So if you scroll a little bit down when you're at whenyouneedafriend.com, you'll see my sponsors page. And I have sponsors like Keep Me Safe Organics, First Alternative Care, which is, oh my gosh, for $19.99, unlimited dermatology, unlimited family practice, and also 3 hours a year of behavioral health counseling for $19.99 for your entire household. That's just one of the many things. Keep Me Safe Organics keeps all the toxins and the poisons out of your beauty products. Can you imagine that? The pharmacy in Merritt Island. And of course, we have Live Longer Medical, making us as beautiful on the inside as we are on the outside. And my affiliate programs with Ground Therapy, Brain Tap, and First Alternative therapies with Avasia, who's helped manage pain for herniated disc. And these are all products that you can find at Live Longer Medical as well. And so finally, you can become an enrolled student in the classroom, whether you can donate $1 or $1,000. It is up to you. We also need your time, your talent, and your treasure. So please support my sponsors the way that they are supporting the classroom. So today we heard from Tyler Dickman and also Troy Bell. We have Troy with us. These are patients of Live Longer Medical who have experienced pelleting, and I'm sure other services. I have bragged about the IV services that I get when I go to Live Longer Medical, but just recently I drank the purple Kool-Aid and I said, okay, let me try this pelleting. So I want to ask you, Troy, a question. Did you have any problems with being hot all the time or having hot flashes?
Yes, I had night sweats quite a bit and hot flashes at work. Those have all gone completely away.
Have they really?
Yes.
You see, that is something that we don't talk about. So I was having, poor Robert, he just said to me the other day, our power bill is much higher than it needs to be, because, I had to bring the AC down to 75 so that I could sleep through the night. But I also like to be real comfy. I like to warm myself up with my blankets. So it was this, I'm too hot, I'm too cold, I'm too hot. So the sleep quality, has your sleep quality, Troy, improved at all?
Yes, very much so. Not just because of the night sweats or hot flashes, but also I believe it does help your entire sleep, what do you call it, the REM cycle or whatnot. Yeah, it does help that tremendously.
I just thought maybe it's just me. So I thought, well, let me ask you, Troy. I was experiencing, not like, we have a friend, Lisa and I have a friend that she gets these really, really hot flashes, and she just has to fan herself quite a bit. And I told her, I said, go to Live Longer Medical. I did. I was like a walking commercial for you, Lisa. And so
Thank you.
basically, that was the first thing I noticed, that my thermostat is in order. It just like, and that was an almost overnight. And I know you set my expectations and you said it may take 2 weeks or whatever, but for me, it was almost, that was
Yeah.
almost overnight.
Yeah.
And so I keep noticing different things from having the pellet. I don't remember when I had the pellet. It could have been like maybe a month ago, but now my AC is at 78, believe it or not. So even at night, it's 78. So Robert thanks you too, Lisa.
Yeah,
So,
good.
so anyway, I have experienced that. And yes, there is a lot of other side effects that I've seen. And like Troy said, very gradual. It wasn't like I'm like ready to, you would think that if you had a lot of testosterone, but here's the thing. I tried creams. I tried medication patches, just like Troy. Nothing absorbed. When I discovered, and I just, you know, when you're doing patches and creams, and you just assume your numbers are okay. And when I looked at when Lisa and Tina, not me, I mean, I joined them in the review, when they saw that my levels were like almost zero. What were those creams? What's going on with the creams and the patches that is not working as well? Is there?
Well, I think, you know, it varies from person to person. I think some people just don't absorb them very well. I've had patients over the years where they do just fine with the creams, but then they hit the point where they're kind of tired of messing with it. And then they switch to the pellets. Years ago, the pellets were not as perfected as they are now. And we use pellets that are in a cholesterol base. And we have found that studies show that the cholesterol is what helps with the absorption and maintaining that in the body. And, you know, I could go on and on about that because, you know, we've all said, oh, cholesterol issues for people, you know, are a marker for heart disease. Well, it can be. I think it can be. It could be a part of a package of a heart disease issue. But, you know, sometimes people just have a genetic propensity to have high cholesterol. It doesn't necessarily mean they, you know, have heart disease. You know, actually homocysteine is more of a marker now than cholesterol. But regardless, the cholesterol is what helps those pellets absorb. And now they've just so perfected them. And I just remember 20 years ago, you know, we were really not sure about it. And so we were sticking to those oral pills. Well, you take an oral pill and you're going to lose 30% or more in your gut because you've got all the acids breaking everything down in it, and you tend to lose some of the potency. So, you know, with the pellets, they're directly in you and they're absorbing, and there's not really much to block it. And, you know, again, like I always tell everyone, it's good to give it a good 6 months because then we can see how your body is using, absorbing, you know, and maintaining those levels. The maintaining is super important. So, you know, those are just, you know, just pieces, you know, that we have to, you know, pay attention to.
Very good. Very good. Okay. So I think you watched this class, Lisa, with Dr. Steven Sinatra. Were you there when you watched that? We talked about the myths of cholesterol.
Yeah, exactly. Yeah. Yeah. I was part of that. And he's amazing. I mean, what he is presenting, he's a cardiologist, right? Am I right?
He is. He's an integrative cardiologist.
Yeah. I really love it. I think he's awesome. I think he's, you know, really presenting a lot of vital information for people.
Yes, yes. And
well, the cholesterol provides a natural, normal way to absorb it because it matches cholesterol in your body. So it's just to allow the absorption, and it doesn't have any significant effect on your levels.
How difficult a decision was this for you, Troy, as a pharmacist, relying on somebody else putting pellets inside of you? Was that like drastic, or was it easy for you to make that decision?
Well, one thing about being a pharmacist and going through the normal medical routes, your average doctors and pharmacists don't believe in anything that's cutting edge or is functional medicine.
Mhm.
So that was something to consider, but I did all the research. I read a lot of information online, and I really believe it's the way to go.
Very good. Was that something that did it saying that people are like so into the pharmaceutical side of it, and like I was, even though I was doing creams and patches, it was more integrative and it was more inclined for the alternative path. But some people take synthetics. Yes. Yes, Lisa, go ahead.
Okay.
Some people take synthetics, and it just doesn't go very well for them. And I've known people that have done synthetics and have had all sorts of side effects. Did you try any synthetics to help you with how you were feeling before trying pelleting?
I did not try necessarily the synthetics. I know that Premarin and unnatural forms of progesterone do bad things to your system. Mm-hmm. And they believe those are the ones that cause the cancer and whatnot in some of the trials in the past. And that natural is definitely the way to go. So even when I was doing the patches and pills, I was doing the natural form of progesterone versus the artificial. That's very important. And the patches was just the estradiol. Another thing I do is I take the DIM, which is, it's derived from cruciferous vegetables, and it helps the estrogen metabolize to the cancer protective pathway instead of the cancer causing pathway, because there's different forms of estrogen. There's E1, E2, E3. There's, they're known as estriol and estrone and all of those. And what we want to do is move all those to the protective, and some of those estrogens are cancer protective.
Yeah.
So I've added the DIM, which I did all that research on my own and added it. I know that they sell it there at Live Longer Medical.
Yes, yes.
They have quite a few pharmaceutical grade natural vitamins and minerals there. They do the blood tests to see if you're a poor methylator, so that you can, if you're a poor methylator, what folic acid you're getting from your foods or your vitamins is actually not helping you unless you're taking the methylated form. And the methylated form of the B12 as well is definitely more helpful.
Yes, very good. So if you were to, now your friend talked to you about getting pelleted, and are you that kind of friend that tells everybody now to get pelleted, or how do you deal with it? If you were to talk to somebody who's, whether it's a guy or a girl, that is kind of on the fence of, how they're feeling and how you were feeling, what would you tell them?
Well, it was funny because I just got back from visiting my brother, and my brother was having some problems, and he had tried testosterone in the injection form for a little while, and he noticed how much better he was sleeping and how much better he felt. And so I was explaining to him about the pellets and putting him in touch with some pelleting people. He lives in a different state in Kentucky. Mm-hmm. And I sent him this website information as well as some other information that I knew about it. And his fear was always that maybe it would cause cancer, because cancer runs very high in our family. But actually, testosterone therapy helps to prevent prostate cancer, which exactly. is what my dad suffered and died with. Mm-hmm. So I sent him that information as well. So.
Yeah. So let's talk a little bit about that, Lisa. That there are some major benefits to having high testosterone, but we hear all the time, if you have too much high testosterone, then it could cause cancer, or it could be this or that. There's a lot of misinformation out there. What would you like to say of some of the myths that you would like to break down today?
Well, I think Troy really hit the nail on the head. There is a huge theory about testosterone causing prostate cancer, and it's really not accurate. And if you look at the more recent studies, they are showing that healthy levels of testosterone is preventative. And, for a number of years, I owned a medical clinic prior to Live Longer Medical, and we had 20 years of seeing patients and always trying to optimize their hormones, because that's where you want to be. You want to be optimal. And honestly, since I purchased this clinic, I have noticed that some people had been using a lot of the injectable testosterone, some of the men, and it was too much. So, you really do need to find that sweet spot and what's healthy for that person. And you can do that based on their symptoms and their lab testing. And, if you think about it, God intended for us to have healthy hormones. He intended for us to have very optimal levels, but we've all lived and we've all had experiences in our life, but we've lived in different experiences where we were exposed to, who knows what. It could have been poor water, or, lead and paint, or, a mouthful of amalgams. There's all kinds of things that can block pathways that need to function optimally. So, again, I hate to sound like a broken record, but it is personalized. It is what that person needs specific to their well-being and to their longevity. But hormones are tricky. But again, it's to me, it's not rocket science. It's really just paying attention to that person and listening. And we used to say, if you listen long enough, a patient will tell you what's wrong. So I do think that's something we're good at.
I'd like to say that, there's a lot of pseudoestrogens in our water. There's pseudoestrogens in the plastic products that we use if you drink from water bottles or whatnot. And those pseudoestrogens, they're not the normal hormones in our body, but what they do is they attach to the receptors of where our normal hormones would attach. They affect our body's information. So then our body thinks, oh, I have all of this, I don't need to make anymore. And a lot of it is environmental, as far as what we're exposed to, pollutants and pseudoestrogens in the water and the plastics and whatnot, is really why maybe we need hormone therapy to be regulated now more than many years ago. And when it comes to, if you're talking creams or even testosterone injections, I know we do sell a lot of testosterone injections through the pharmacy, but you're getting peaks and troughs. So you're getting highs and lows. So you're getting side effects on the highs and side effects on the lows. And they end up prescribing you more so that the low doesn't hit as soon. But really, that's not as safe as doing the pelleting, where you're getting a slow release throughout 3 to 4 months. You're staying at a normal, steady state level versus getting the side effects or the potential problems from the highs and the lows.
I love it. I want to encourage all of you who are watching to consider this. I mean, everybody's different, and I'm not telling you what to do. I'm just saying that if you are feeling, exhausted all the time, brain fog, what are some other symptoms, Lisa, that could be attributing to, either too low estrogen or not enough testosterone as well?
I see motivation as a huge issue for men and women, because I think without proper testosterone levels, especially in men, you just see a lack of motivation, and it does make patients that come to us anyway, kind of like Tyler said, he was put on a lot of different antidepressants. So it's people mistake it, I think, for depression, and low motivation can, be affected by low testosterone. So I think that's a huge issue. Brain fog is huge for women. I think our female hormones really cause brain fog and memory issues, and, short-term memory even, we're like, where to put my keys? It's just something that you don't want to excuse that for age, because my mother's 85. She weighs 110 pounds. She's 5'2". She can lift as much as a 20-year-old. She's super strong, super healthy, and she has an amazing memory. So you don't have to lose your memory just because you're 85. And, that's a whole other story. We could talk about that for an hour, because there are other things that cause memory loss. But hormones are huge for women in that category. And it's kind of like Troy said, and I so appreciate all her wisdom, because as a pharmacist,
absolutely.
She really gets the biochemistry, and I'm so grateful for that.
Yeah.
And this was super helpful to have that. But, it's so true that, we're influenced in our environment by all of those estrogens that are not bioidentical like we really need, and they can affect us so negatively. So, I think just knowing your own biochemistry, knowing your hormones is vital, and something important that I would advise excuse me, everyone to take a look at, 30 years or older. And, for men that are having issues with energy and working out in the gym and stamina, even if you are in your 20s, make sure they check your testosterone level. That's vitally important to men. And we always look at free and total, because you can see, what they have is a total level, but the free is what's moving around and being used. So, it's critical to look at both.
Well, okay. So you say, no, the world says, as you
Mhm.
get older, your testosterone should go down. That's the way God created it. But what I'm hearing both of you say is that that's not necessarily true, that is a belief that we've been fed that supported us when we were younger. But now as we get older, we realize, it doesn't have to be this way. It's
No.
because of the plastics. It's because of what we're eating. It's because of how stressed our lives are, that these hormones are, and there's so many low cholesterol diets, our nutrition is out of whack. So it's going to affect our cholesterol. And by the way, check out that if any of you have seen Dr. Sinatra's, I just did the class a couple of days ago. I'm trying to remember how long ago it's been. Maybe it was last week. My days just blend in. I need more pellets, Lisa. Anyway, so, but anyway, it was the myths about cholesterol. And one of those is, that helps our sexual organs
Yes.
and also mental health and cholesterol, that they're trying to keep us away, and these low.
Mhm.
So there's a lot of, that's why I call everything I do new truths, because there's not a truth out there. It's new truths that we need to embrace and just research it. So with that in mind, the older you get, the lower it get myth that's been busted right now, what would you say are some of the things that we should look at? What are the numbers that we should look like? With me, it was like, oh, I remember Tina looking at me going, you got like nothing. You got
Yeah.
nothing. I got nothing. Nothing. I got creams. I've got patches. Nothing. Got pills. Nothing. Okay. So let's talk about, what are the numbers? What are the numbers that we should look at?
Well, when it comes to the labs that we draw, typically we always draw CBC. We always draw estrogen levels, total estrogens. We look at free and total testosterone. We do an FSH. We like to look at progesterone. So we look at all of these things. We even look at thyroid, because thyroid also, it's a hormone. It plays symphonically with how our hormones work. And I just realized we didn't talk about sex drive. That that's a huge one for men and women.
Did you notice that we avoided that? Both of us, we all avoided.
Yeah, what the heck? You know what? The men in our lives, I don't have a man in my life right now, but for the potential man in my life, those are important things that they like to know we are taking care of too. And it does affect your sex drive, especially for men and women. Women need testosterone just like men, and it does affect, how we, can function with our partner. And for men with low testosterone, it will affect their erectile dysfunction. And if you do increase their testosterone, it can also make a difference and help with that part of life.
Well, it
as
helps
well.
us focus, and part of
Yeah.
part of of that intimacy is being focused on what you're doing and not doing the grocery list. It's like,
Yeah.
okay, like your mind is like going everywhere. So okay, so what should the number look like? You said you have the testosterone and the total. What should that total? What is
Well,
the number range?
I don't have it in front of me, but for men, we like to see men between 850 and 950. That's optimal. Okay, that's optimal.
Yeah.
I mean, we have patients that come in, and I think the range, again, don't quote me, I think it's 250 to 950 or 1,000. And it also depends on the lab, because all the labs are different.
Yes.
And they all have different ranges. So we try to look at their range and kind of compare it and have it make sense. But, we've had men that come in at 253, and their doctor will say, well, you're in normal range.
Mm-hmm.
They feel like crap. They can't work out. They have no sex drive. Their wives are upset with them. They can't work out in the gym, and they're not motivated. And of course, during COVID, that was just, all of the stressors that people are going through. And then to have low testosterone on top of that, it's difficult.
Yeah.
So, at least, I've been saying to patients, take care of yourself during this time. Take care care of your hormones. Make sure you're taking your vitamins. Take those things that keep your immunity strong. Keep taking care of yourself. Don't get swallowed up in all of the negativity. So anyway, back to testosterone for men. That's vitally important.
Well, we're going to continue this conversation on the Teacher's Pet Corner after we're done with the podcast. But I want to thank both of you. I want to thank also Tyler for coming in the classroom today and being so brave. All of, both you, Troy and Tyler, thank you for taking a stand, because either one of you have this could be an embarrassing thing, but I'm glad you've taken a stand saying this is not embarrassing. This is life. And so I'm glad that you guys have done that. So thank you, Troy and Tyler. You're going to be watching this a little bit later. And Lisa, thank you so much for everything that you do. We're going to continue the conversation with the Teacher's Pet. So if you have any questions, make sure to ask. Please remember, we'll always be here waiting for you worldwide at whenyounneedafriend.com. This is Lillian McDermott, Lisa Geyer, and Troy Bell. And of course, Tyler, wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Yes. Okay. Remember, 321-327-2980. And that's livelongermedical.com.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
I don't know what's happening with Zoom lately, but it's not letting us unmute me. So unmute yourselves as well, please. So I've got some people asking lots of questions. So hello, Debbie. So glad that you can join us. And Veronica, and let me see, for those of you who are watching, I know that there was a steady stream of people watching today. This is a topic that is a little uncomfortable for some people. And some people think that, oh, this is the change of life, that we're going to have to sweat it out and, not be able to sleep and that this is going to be remember, Lisa, this conversation started with us when we went to see the musical, what was it called? What was the musical called? You're muted, Lisa. It was that musical that was about
There we go. Menopause.
Oh
yeah, it was great.
We're still in denial. We don't know about menopause. Lisa and I laughed so hard that night.
Oh,
I saw that movie.
hilarious.
I saw that play back when I was probably in my early 40s, late 30s. And I'm watching all these ladies laughing, bending over, laughing.
It wasn't as funny then, was it?
No, I'm like, this is sad.
I know. It was.
I can't imagine going through that. What's so funny about that? And I just didn't see the humor. But now having, gone through some of the experiences, we can laugh because we know better. It doesn't have to be that way, right, Lisa?
Right. That's right. Absolutely. Yeah. Something I forgot to mention is we always check a DHEA too. It's one of those anti-aging hormones. And it really is the hormone that kind of pushes testosterone along a little bit. And I love DHEA. It's just a wonderful hormone.
Well, what do you love about it, and what kind do you
Well, to me, anything in a liquid absorbs better. So I use a spray, and I'm trying to think of the name of it. It's made by Metagenics. We sell it in the office.
Longer? Okay.
We do. We have
I'm going to get some.
And it's just, I squirt it under my tongue, every morning. And I just feel it increases my energy and my cognition. It really makes my thoughts sharper, clearer. And I don't know, it works for me. I love it.
I see Troy nodding her head. What do you think about that? It's like, I could hear her already. So
Yes, when I take the DHEA, I notice a significant level of energy and feeling better. And if I could say something really,
what's the percentage? The dose.
I don't know what mine is in the liquid. I could go grab it real quick and look.
Because I remember a long time ago when I was beginning to experience, and I'm talking a long time ago, when I was experiencing this, because I'm 57 now, so this has been a process. This is a process. I remember buying some tablets, some DHEA. The doctor had suggested that I get some. And I remember Robert saying to me, You were so much nicer before you started taking those pills.
Oh, well, that was fun.
Okay, Robert. After I bit his head off. No, I'm just kidding. But no, I did. But anyway, so what would you like to say, Troy?
I was going to say about the cholesterol that our natural hormones are made from cholesterol, and our brain neurons are made from cholesterol. So it would be completely natural for the bioidentical hormones to be made in cholesterol.
That was a shocker for me. That was the first time when Lisa, that was brilliant, because that was my takeaway moment today, was to learn that it all makes sense now. That was the missing piece to me. If I would have known that sooner, that it was based with cholesterol, I would have just not had how long did you and I talk about me getting pelleted?
Oh, we did talk about it for a while. And, I think it is, there's so much detail around it. And like I said, years ago, I don't think they were using cholesterol as a base. And I don't think the pellets worked as well, 20 years ago. But wow, now I see such an enormous difference. And we're super picky about where we get them. And that makes a big difference too. And Tina, it will only get them from, one pharmacy. And so we stick to using Wells Pharmacy for that. And, and then there's Jennifer, who has been with us for a really long time, and she has the same perspective with hormones. She really, really wants to be sure that what we're putting in people is the right version. So. Yeah.
Very good. Troy, is there anything else that you would like to add to this conversation? Because it almost is like this is a born again moment for you, being a pharmacist and relying on pharmaceutical drugs that may or may not be synthetic. Going with something natural may be against your training, not necessarily against your intuition, but against the training that you've experienced. Was it difficult for you to step away from the training aspect, where many doctors tell me as an allopathic, going to a more natural was a huge leap for them. But once they made that leap, they were so glad they did.
Well, not really, because I do believe that, we need to take care of ourselves with what we put in our bodies. It needs to be as natural as possible. And I've never been a fan of synthetic drugs. It's just a living for me as far as that goes. And really quickly, if I can share a list I have of all the different symptoms.
Sure.
Therapy can fix: depression and mood swings, anxiety and nervousness, hot flashes and flushes, night sweats, urinary leakage, vaginal dryness, sleep disturbances, muscle loss, fatigue, concentration issues, loss of libido or inability for orgasm, joint pain, brain fog, and weight gain. Is a list of the different things that decreased hormones can create, and fixing the hormones can fix.
Yes. Just a few, just to name a few, because, it's one of those things that those few things that you just named are huge things that we learned to do without. Yeah. Why are we such martyrs? It's bad enough that we have to raise our children and give everything to them and put them first. And then, as they're gone, you're still putting everybody else first. At what point do we say, enough, I'm going to take care of me? And I don't know, for those of you who are watching right now that can resonate with this, I want to hear from you. I want to hear where you're watching from. I want to hear what you've learned today. I want to hear what you're willing to do to take your health back. So Lisa, what were you going to add before I went on my little rant?
Oh, no, that's all right. I was just going to say the range in most of the labs, I just looked at a couple of them, 3 to 41 for women for testosterone levels. And, again, so if you have a testosterone level of, 4 or even 10, they're going to say you're in, I've got yours sitting here. I'm looking at yours. I'm looking at yours. So, you were pretty low. And, so if you don't, 40, even in the 40s for women is it's optimal. That's where you'd like to see it. But, I've seen people that, their testosterone levels for women were 4 and 5 and 6. And, to go to your doctor and they're like, yeah, well, that's normal. And you're feeling all these horrible things, you do have to address that, because that's making up your overall sense of well-being.
Yeah. And then, of course, I had my progesterone and my estrogen also tested, which a lot of
Yeah,
doctors don't test progesterone. And
right.
because of it, Tina increased my progesterone because
Hmm.
I was doing 100 and she increased it to 200. And again, these are natural medications. What would you call it? If it's natural, is it considered a medication, Troy?
It's bioidentical.
So it would be
So
considered
it matches
bioidentical.
exactly. Right.
Okay. So it's not necessarily a medication, but I take a pill form of the progesterone.
Hmm.
And that also helps people sleep very well at night.
Oh
Yes.
yeah,
And for
that's
many years, I have to tell you, if any of you out there that are listening, and I know you guys will not be able to relate to this, but if your uterus has been removed, like my uterus was removed, I did not have a total hysterectomy, but my uterus was removed. The doctors will say, "Oh, you don't have a uterus. You don't need progesterone." That is bull.
You need
Bull.
progesterone.
you
You
do.
need progesterone. So all of
Yeah.
you out there that are suffering and you think that this is just a rite of passage, think again. Lisa, any final words before we go?
I was watching the other day, Suzanne Summers. I've had several meetings with her over the years, and long ago when she wrote Knockout, which is one of her books, and she signed it for me. And there's a conference that I go to regularly. It's called A4M, and she really loves to come to the one here in Florida. And of course, who knows when we're going to get to have that again? But I was watching one of her programs, one of her older programs, and I was remembering years ago, and I'm thinking this probably was 15 years ago when I met with her, or maybe 12 years ago, something like that. She was passionate about educating women about hormones. And I give her such credit for, treading that path and helping with awareness. Because her passion was to open up hormone clinics all over the U.S. Thankfully now they're popping up everywhere. But it's so wonderful to get that awareness out there and educate people, because it is something that is lacking in our traditional model.
Yes. Okay. So we're about to leave, but you know what? If you have a question, make sure you type in a Q, ask your question. So we just had Veronica join us about 20 minutes ago from Arizona, but is interested. She goes, I was just told my thyroid is enlarged and blood work done and ultrasound. Also, my uterus was removed as well. So she says, let's see. So that's good. And then, okay, wait a second, Veronica. And then there is, wait, okay, she said, Mierla. I'm so sorry if I pronounced your name wrong. She says, wow, I have all those symptoms that Troy mentioned. I need to make an appointment at Live Longer Medical. Of course you do. So,
Yeah.
listen, 2 for 1. If you don't live in Florida, you come to Florida and you get to see Lisa at Live Longer Medical. And you might run into me or Troy. You never know. You get an extra bonus as well. So I don't know. Can you guys hear me okay? Because Robert is telling me that you guys can't hear me. Hold on a second.
I hear you fine.
You hear me fine?
I hear you perfectly.
Hold on a second. I'm going to do something. Why don't you, Lisa, talk a little bit about Live Longer Medical and some of your services, and I'm going to adjust my mic, okay?
Okay. So in our clinic, we really start with an assessment, a lot of questions for patients to answer, so we can get a feel for what they're presenting with. And then secondly, we do a lot of comprehensive testing. And I'm not sure, Troy, if you've done the NutriEval test, but it's just one of my favorites because it really takes a strong look at biochemically what your body is able to use. It looks at all the nutrients in your body. It looks at essential fats. It also looks at heavy metals. What else am I forgetting here? But anyway, it just gives a good assessment of what you have. And then what I've been doing is having patients do a genetics test with it, because your genetics will present with where you're headed. But then the NutriEval tells what you're already doing, what you're already dealing with. And then we try to look at a comprehensive way of shutting some of those genes off that maybe need to be off, that you don't want on. And then, so that's some of the things we do. We do IV therapies, we do chelation. We're in the process of starting ultraviolet therapies. We have photoluminescence in the office. We'll soon be doing ozone.
And
These
the
are things
wave? The wave for
And
men?
the wave is new, and we're getting flooded with calls about the wave. It's a very, very cutting edge treatment, and Tina has been doing it forever, and so has Jennifer. So I have 2 practitioners that are amazing with that treatment for men. It also, believe it or not, if you've got some cysts, we can use it on cysts, and it'll help break them up a bit. Depends on the type of cyst. So we'll be using it for a lot of different things. Anyway, and we do some aesthetics. Patients come in, they want a little Botox or Xeomin or some fillers. We do a little bit of that. We do the O shot and the P shot, and those enhance orgasm for men and women.
And by the way, if you want to learn a little bit more about the O and the P, you can go to previous classes that we've done with Lisa. Go ahead.
There you go. And then, goodness, what am I leaving out? Because we do just about everything. Bioidentical hormone replacement therapy, that's big because it's a huge piece of our life. So we always take a good look at that. I think that's about, I've covered most.
And you had 3 people today that have been patients at Live Longer Medical. And I absolutely love all of you. Your staff is wonderful.
Thank you.
And okay, so I want to go back to Veronica's question. I don't know if her question is, but she's saying that she joined 20 minutes ago from Arizona and she's interested. She goes, I was just told that my thyroid is enlarged. So she had blood work done and an ultrasound, also had her uterus removed. So I don't know what your question is, but I'm wondering if an enlarged thyroid has anything to do with low testosterone or progesterone or estrogen. Can that be related or correlated, Lisa?
It could be. I mean, they all work together, but she really needs to get a detailed assessment. And I highly recommend she find a practitioner in her area that's very skilled with thyroid, because there's, a huge gap with thyroid treatments, and sometimes subclinical thyroid issues are ignored. And a patient can have, there are about 14 symptoms of low thyroid. And we actually have it in one of our questionnaires because it kind of gives us a feel if it's something, we need to address. But at any rate, it's pretty important that you get that, get a detailed assessment of that, especially if they're already telling you you've got an enlarged thyroid.
If I can add something to that.
Yes, please. I was
Yes,
just going to
please.
ask you. Yeah.
An enlarged thyroid can be Hashimoto's disease, which is sort of an autoimmune thing. It can be set off by diet, by gluten, dairy, maybe, depending on what you're sensitive to. I can tell you that the average doctor is going to draw like 2 or 3 thyroid labs. And if they're within normal range, they won't believe that anything needs to be treated. But a functional medicine practitioner will look at about 6 different numbers for that thyroid level and realize that you can be in therapeutic range, but your thyroid is still struggling, and let's treat it before it goes so low it's not functional anymore.
Yes, absolutely.
Perfectly said. It's exactly right.
I was going to turn to you. For those of you who are just tuning in, Troy is a pharmacist. So she has this clinical background that, she's been trained with pharmaceutical drugs, but she has also seen what alternative medicine has done for her. And so I'm grateful that, there's a lot of titles out there, MD, DO, PhD. And when you are bought into that training, sometimes it can be very difficult to represent anything other than what you've learned. You've spent a lot of money. I'm not saying you, but they have spent a lot of money getting this training, and and to pay for the student loans, to pay for all this. Sometimes you have to just keep doing what you've been taught. Mm-hmm. It takes a remarkable person to say, whoa, look, there's other things that are available. And these are things that help us as well. For anyone that has anything with their thyroid, it's so easy for the doctor to say, oh, you need your thyroid out. And it's because, I just did just recently was doing a research, and they were saying that, I've said this before, fear controls, right? Mm-hmm. And so the what's happening with the viruses and the things that are out there is about fear. And what happens when you get a diagnosis? Fear. Mm-hmm. And so we've got to step back and say, this has been going on for a while. Let me research it. And that's something that you did, right, Troy? You said, well, let me research it before. So if you'd like to speak about that.
As far as researching
about research,
biological hormone therapy.
stepping outside of the belief that things have to be a certain way. This is what you were trained, this is what you were told, but maybe there's another thing out there that that doctor doesn't represent and they won't tell you about.
Right, right. Well, there is a large organization of doctors here that if it does not come from the American Heart Association or the Cardiology Association or if it's not one of those published guidelines, that's the only thing they do for you. They don't treat the patient, they treat the guidelines.
Mm-hmm.
Yeah,
So if
exactly.
those guidelines aren't working for you, and maybe a different medicine might work for you or an alternative therapy might work for you, they won't treat you.
That's
Yes.
right.
So it's important to find a doctor that stands independently enough to be able to research
Mhm.
newer methods and therapies that that don't fit the normal paradigm. So
Yeah, that traditional paradigm, and finding doctors that will think outside the box.
Yeah.
Because there are new amazing discoveries every day. I didn't even mention we do peptides too. Peptides are awesome. There's 7,000 naturally in your body.
Mhm.
And I just finished my certification in peptide therapies about 1.5 years ago. And I can't tell you, but every day there's a new peptide. There's something new that we're discovering. And you have to be willing to continually learn. You have to have a teachable spirit, to me, to be a very good practitioner. And, your patients come in, and if they have, hey, I read about this, you have to be willing to research it and say, you know what, I don't know about it, but I'll look into it.
Yeah.
And if you have a practitioner that's so stuck in the mud and they're not willing to, step outside that box, it's difficult. And would concern me. So I would encourage you to find a practitioner that's really going to be a part of your team and think outside the box and be willing to learn. And that's true of everything in life. We always have to be teachable. But I think in medicine, it's vital, because if you're not, finding out what's new and what's cutting edge. Years ago, I did some training with Farrah Fawcett's physician in Germany, and her name is Ursula Jakob. And she's brilliant, absolutely brilliant physician. And it blew me away what they were doing in this clinic, that we are so behind in our country. And we are still not doing all the things that they're doing there. And, it's amazing how in Germany, they just think outside the box. And it's kind of a normal thing for them. But here we have so many regulations. And while it can be good, there can be some goodness to that. It's limiting. And, I have concern that even stem cell therapies, to me, there's probably people in the grave that could have benefited and still be living had we been a little more open to things like, and we do stem cells in our office too. Forgot about that. But, so we kind of do. If it's cool, cutting edge, has science behind it, and it works, we're going to do it, unless it's, something that's not right. But, if it works for people and it's going to help them get well, that's where our focus is.
Well, once again, I want to thank you both. Live Longer Medical is in Indianapolis, Florida. It's a quick drive if you're listening in Florida or Georgia, or it's a quick drive to come visit, and or you can just call Lisa at 321-327-2980, Live Longer Medical. You can also go to livelongermedical.com to learn more. I am grateful, because it's once you see the light, we just got to stop with all the embarrassment and shame and all the martyr victim mentality. It's time to take our health back and say, you know what? It's about being unique. One size does not fit all. And if you have a doctor that, think about this, most clinics are based on you being sick. Most medications keep you well enough. And I apologize, as a pharmacist, I'm going to say this out loud and you're going to hear some of you might want to cover your ears, but the medications, the synthetic drugs, keep you sick enough or maybe just well enough to take the next medication. So at what point do you choose to say, okay, I want to do this as naturally as possible and do this for myself? And do the research. Is there anything alternative? You can always reach out to me. If you feel that you're embarrassed and you don't want to ask a question, you can always call me at 407-373-5959 or text me your question and I will forward it. We've got to eliminate the stigma that somehow there's something wrong with us. if we just don't feel as good as it needs to, we think we should be. So it's time to take our health back, and you maybe start with Live Longer Medical. So thank you, Lisa, for being part of the class and teaching all of us, how to take our health back. And Troy, thank you for taking a stand and saying, even if as a pharmacist, I acknowledge that there are other things that people can opt for. So thank you.
Yeah, you're amazing. Thank you so much.
Yeah, that was great.
This was great. Yeah.
Great. Okay. So we're going to say goodbye on Facebook
Bye.
and YouTube.